The recent deaths of two black doctors in Indiana hospitals has a local group asking for accountability and justice for the two doctors, along with reforms that would improve the experience black women in Indiana are having at the doctor's office. WRTV reporter Cameron Riddle is working for you tonight, explaining the grassroots effort that could lead to change.
The death of Indiana doctor Susan Moore is attracting national attention and calls for accountability after the physician and black woman posted about the poor treatment she received while battling COVID-19 in the care of IU Health North Hospital in Carmel, including one moment when her doctor tried to send her home.
At that time, I'd only received 2 treatments of the remdesivir. He said, you don't need it. You're not even short of breath. I said, yes, I am.
Dr. Moore journaled her stay at IU Health through updates on Facebook, eventually posting that after several complaints, her treatment from hospital staff did improve and she was feeling better. Doctors then sent her home. But 12 hours later, Moore posted she was going back to the hospital, this time to St. Vincent Hospital, where she died days later. Moore made it clear she believed she received poor treatment at IU Health because she was black.
He made me feel like I was a drug addict. And he knew I was a physician. And I maintained if I was white, I wouldn't have to go through that.
Dr. Moore is the second Indiana doctor to make headlines after dying in a hospital. The other is Dr. Shanice Wallace, a pediatrician who died after having a baby in October.
This forces us to think about how many black women are dying that we just don't know about. How many black women are asking for pain medication? How many black women are saying, doctor, this is what's going on in my body and I need help, and are being ignored?
Alexis Tardy is a minister and organizer with the social justice group Call and Response. They're petitioning for accountability and justice for Dr. Moore and Dr. Wallace, while also hoping to shine a light on old medical misconceptions that African Americans have a higher tolerance for pain than their white counterparts.
Ethically, we need to speak to our system that is producing the circumstances where these two black women have died. There is something seriously wrong that needs to be addressed. And if that needs to come out as a firing, then fine.
Cameron Riddle, WRTV.
IU Health President Dennis Murphy says the situation Dr. Moore described is deeply troubling. Now, the doctor released a statement to WRTV tonight saying, in part, quote, in addition to an ongoing internal investigation into all aspects of her care, IU Health is conducting a third-party independent review of her case, as well as our overall patient care and protocols and procedures, led by outside healthcare and diversity experts. Whatever the findings, we will own the results and take whatever action is needed to uphold our commitment to equity and racial justice for our patients, end quote. You can read that full statement on our website at WRTV.com.